Yesterday, ladies and gentlemen, we started our chapter 11 talking about heart block. And I told you, and I would like to review. Number one, we mentioned that heart block can be determined by the measurement of PR interval. And we are familiar about the normal PR interval range between 0.12 to 0.20 seconds. Any delay of this conduction, it may be physiological, it may be pathological. What is the physiological? We mentioned that this is happened by the gatekeeper. You know that the gatekeeper makes like the delay of conduction range between like 0.05 seconds. And this is like for our safety of our heart. And lastly, we have like to mention that if we find that the PR interval is prolonged, and in this situation, we will say this is like first degree heart block. But I need to remind you that it is not just the word prolonged, but it is fixed. So prolonged and fixed, it will be stage or heart block grade 1. Then the second degree of heart block is going to be subdivided into Mobis type 1 and Mobis type 2. What is the difference? Mobis type 1 is so close to be like the first one, first degree, and it is like a little bit safe. But the second type of Mobis is getting to be like more worse, as it is going to be terminated by third degree. We stopped yesterday about we finished also first, second, and the second Mobis type 1, Mobis type 2, and today we need to continue with the third degree. We mentioned in Mobis type 1, we have prolonged and progressive. Mobis 1, prolonged and progressive. Mobis type 2, we have some P's with 1 QRS, and we mentioned that we have a ratio maybe like 3 to 1, 2 to 1, and so on. Now we are going to the third degree heart block, which is the most important and serious one. And this one, which is the third degree heart block, we call complete. Can lead to what we call asystole. And we touched this word before. Asystole means there's no contraction and the heart or the ventricular contraction is ineffective. And according to this, we are considering that this is what we call lethal dysrhythmias. And this lethal is very important to be like do cardioversion, and we got this word also before. Let us go to identify what is the criteria of this third degree heart block. We will find that the beats are independently of each other. So we can find like the SA node give fire rate from 60 up to 100, but the ventricle is not the same. So the ventricle, or if we can say that, we will find that the P waves, which represent the atrial contraction, is within this range, and the ventricle is out of this relationship. So they are totally dissociated. So we call independently, okay? What we have to know, ventricle paced by an escape pacemaker. We mentioned what is mean by escape rhythm, that the the SA node is like working at independent, and the QRS is like narrow or wide. It depends on that which one is working. The ventricle working by itself, so it will be wide, and the range is 20 to 40. If the ventricle is not working by itself, so the normal or the narrow QRS will be there. So what is the items which we need to remember? That this word, no relationship is noted. Okay, when you find there is no relationship, you can't reach what is the relation between SA node or atrial contraction and ventricular contraction. If you don't find any relationship, this is what we call third degree heart block. Is it clear? Then we have the golden slide. As I told you, you have to like review, and we find that what is the heart rate? The atrial is going to be 60 up to 100 beats per minute, and the rhythm, the atrial rhythm is regular because it is sinus, but the ventricular rhythm may be regular or maybe irregular. And there is no relationship to the QRS between P and the QRS. And we have the PR, of course, it will be vary, and there is no pattern. There is no pattern. So if I need to summarize, what can I like recall all my knowledge? If I find that PR interval exceeds the normal but fixed, this is first degree. Exceed the normal but it is progressive followed by drop of QRS, this is second degree Mobis type 1. If it is progressive and we find that we have some P's without QRS, so this is Mobis type 2. If we find that there is no relation at all, like we mentioned earlier, this means third degree. So here we have the fifth one. Say, do all QRS complex looks alike? Yes, because they're coming from the ventricle. What is the length of the QRS based on the side of the escape pacemaker? Maybe coming as ventricular, so it will be wide, or coming from other part, which will be narrow. So take care of this statement. It is going to like confusing you during your exam, asking you about, do all the QRS complex looks alike? Take care of this answer. Let us start by one of these items. Don't look to the header. The header say that this is third degree. Let us confirm this is third degree or not. Okay, who will start with me, please? No one would like to share with me?
I can go.
Okay, Makisha, good job. What this wave?
This is a third degree heart block because
No,
the
I don't. I can understand
Oh,
what I am. We need to go. If you read this one, we can read this one, of course. I need
all
to
right. That's the P
analyze.
wave.
I said, don't look to the header. We
Yeah,
need to go by
sorry.
ourselves. Okay.
That's a P wave.
P wave, and this one,
Another P wave.
very good. And this one,
That's a P wave.
no.
T wave.
What is T wave? Yes, we mentioned after the QRS should be
Yes.
T wave. Okay. And it is bigger than P wave, of course.
Yes.
So what do you think about this QRS?
The QRS looks narrow to me right now.
Or narrow, let us count. Let me make the arrow to be small. So if I say here, We go from here to here.
I would say it's 10 seconds.
So it is like 1, 2, 3, 4. 4
Oh,
and a half. 4 and a half. So 4 and a
So-
half small box equal how much?
20.
Let us say 4. So 4 times 0.04 equal 0.16.
Oh,
You agree?
0.16.
So it is narrow or wide?
It's narrow.
Wrong.
Wrong.
Is it
What is the
wide?
normal? What is the normal QRS? Yes, Joanna?
It's wide.
Wide, correct answer. Because we know, Makisha, that the normal should be less than 0.12. And now it is 0.16. So it is wide, not narrow. You got it?
Yeah.
Good. So we have 2 P's and 1 QRS. And this QRS is of ventricular character. Again, what we mean by ventricular character, it is wide QRS. So this means what? You will say that why I am not saying that this is like MOBIS type 2. This is tricky question. Let us think together.
Because none of it makes sense. Like,
Why I can't say that this is because we have here some P's with 1 QRS, or I can say that this is 2 to 1. It is a tricky question. This is 2 to 1. You see, 2 P's and 1 QRS, 2 P's and 1 QRS, 2 P's and 1 QRS. So why don't say that this is like second degree heart block?
Because isn't the ratio isn't like 3 to 1 or 4 to 1?
Say it again, Zara.
Because the ratio of the drops, isn't it for secondary degree type 2, isn't it like 3 to 1? So there'd
Three,
be
it is actually not 3, it is 2 to 1.
oh, okay.
But this is the tricky point. You say that this is 2 to 1. Okay, I agree, but this is not the second degree. It is third degree. Why? We need to think together.
Because all the P waves
No,
are even, and then all the QRSs are even.
no, it is not related to the P wave, Zara.
Okay.
Think again.
Is it because there's no
Heart rate low.
The heart rate is low. Okay. So the heart rate is like 30, right? Correct,
Yeah.
Erin? Okay. Okay. So this is one item, but it is not strong. We need another strong. Strong
because
reason.
there's no pattern to the rhythm?
No, I have here pattern that I can see P, I can see QRS, but let us go. Don't
There's
Don't
like
get
no
frustrated.
relationship.
Say it again, Lewis.
Well, there's like no relationship between the P's and the QRS complexes. So the PR
This is
intervals
what
are
Irene. This is
the
what
PR
Irene
inter-
mentioned actually, but I can't
the-
depend on there is no pattern, but I can see pattern. To be honest
the-
with you, I can see
the-
pattern that I have 2 P's and 1 QRS, and it is repeating. So there is a pattern.
like the PR intervals are varied.
Yes. Huh?
because
What? Say it again. Good.
The
good.
PR intervals they vary.
No.
Okay.
Look to the QRS. QRS here is wide all the time, right? You notice that?
Yes.
So QRS here is wide all the time. But in second degree, which we call, like you mentioned, Zara, the pattern of 2 to 1 or 3 to 1, we will find the QRS is going to be narrow. So this is the trick. Okay, so I respect all your trial, but the correct answer here is the QRS all the way is wide. Okay, so this means it is working by the ventricle itself. It is not coming from any other sides. And we don't apply, if we go back to Mobis type, we will find that we can notice that the difference is only in QRS. So the QRS here is wide, take notes. And so far it is wide, it is coming purely from the ventricle or Purkinje fibers. And it has also, I can accept your trial that the heart rate is low, which is between 20 to 40. And also we don't have, to be like honest with you, I can't say that pattern. Okay, but we can add this pattern as a reason, but the strong reason, Irene, is wide QRS. You got it? Let us see another one. Here. All right. Who can go by this one? Now it is easy. I gave you the key. Corin, go.
I don't know.
Let us start from the beginning, like we mentioned. What is the heart rate here?
20 beats. per minute.
Hmm?
20?
30. 30.
30. We have here, look to this one.
Yeah.
Right? So we have the heart rate is 30. Okay. Keep going, Al-Hajj.
There is two P's after QRS before QRS. QRS here is wide. Yeah, that's why they say the third degree.
Once, okay. So let us be smart. What
Okay.
this? You look, you are good. You are good. You are doing good job. This is the P wave, this is the P wave, and this is the QRS.
Yes.
P wave, QRS, PP, QRS. All the QRS, like I told you, is or
Wide.
are wide. Okay, and so far they are wide. They have no relation to the P wave. So I will say that this is the third degree heart block. But if I find that the QRS are narrow, QRS are narrow, and the heart rate is within the normal SA node pattern, I will say that this is second degree Mobis. Okay, so this is the key for you guys, is this wide QRS during the study. Okay, here let us look for this one. It is hard, right? It is hard, but let us go by it. Let us go step by step. After we follow the rule, let us identify the keyword. Okay, what do you think this one is what? What this wave?
P.
Good. What this?
QRS.
Very good. What this?
T.
And what this?
P.
So you notice here very important phenomena. Of course, it is not mentioned in this book, but for your knowledge, that sometimes we get that the P wave override what? The
T
T wave.
Yeah.
Sometimes we get this one. Okay, but here we have another problem. What this wave?
P.
And this wave.
T.
So T is positive or negative?
Negative.
So here it is inverted T wave, you're right? So this inverted T wave, actually, denote that this patient has already heart myocardial infarction, okay? So T wave should be positive, except if we are in AVR and V1, but here it is negative. So I find that there is like a problem with the heart. Let us see here. The PR interval here, you see? This is the PR interval, not like this PR interval, not like this PR interval, and it has no relation. So when I look to this one, I can't say that this is first degree, it is second degree, it is third degree. I have no relation. And what is the point? The point is, let us count the heart rate like you mentioned, guys. 1, 2, 3, 4, 5, 6. 6. And the QRS is not wide. You agree?
Yeah.
Okay, Lewis, are you following me? So the heart rate is 60, number one, and the QRS is not wide. So what this? This is third degree or what? If it is third degree, the heart rate should be
Below.
between 20 to
40.
40, but this is 60. And the QRS is not wide. So this is another strip which is not belong to, actually we don't have pattern, but so they consider that this is third degree because I don't have any relationship between the P's and the QRS. Sometimes the P's tell me that this is like prolongation of PR interval. Sometimes I find that it is not belong to the situation which is first degree. So if I say that it is prolonged progressive, it is not the same. So I don't have any key to tell me that this is like working what is the background of this problem. So we will say so far there's no relation, it is what? Third degree. But actually, to tell you, to be honest, this is one of needs high standard level of education. Like you have to have master degree to go in more details about this strange case, because actually this case has myocardial infarction. This is why he has multi problems in this strip. But actually, you are not going to have something like this in the exam. It is above your level of knowledge, okay? But we touch it together to give you like impression, how can we make, what is the relationship? There is no relationship, okay? So let us go to find something else. Here, the clinical significance of the heart block. The first degree, we mentioned that it is not need, or maybe the patient is not complaining of any issue. So all what you have in your chapter talking about clinical issues, you have to read it. It doesn't need more than to read, and you get familiar about what should be like the patient looks like. And it is interesting to get familiar about what we mean by drop beats. So sometimes the patient, all of us, sometimes we get this sensation of drop beat if you are like under stress or after
Yeah.
heavy meal. Yeah, sometimes we feel this drop beat, but not all drop beats is heart block. So take care of that, because this drop symptom or complaint from the patient, it doesn't mean that the patient has a block, but maybe they have a block. But actually, we call this is like what we call extrasystole, and we explain the extrasystole on the basis that contraction coming during the absolute and relative refractory period. I hope everyone gets like familiar and understanding the situation. And as I told you, it is very important for us to go with this. Actually, let me let me trick you. Okay, I need everyone to be like, as I used from all of you actually, what this? Actually, we are going to talk about this next week, but what this? You are smart. I need you to, can I have one of you to start with me? Hmm?
Is the rate 60 beats per minute?
Okay. I need you, your mic is like away. So you said that the heartbeat is how many? 1, 2,
60?
3, 4, 5, 6. So what is the heart rate?
60?
60. Very good. Let us go through the wave. What this wave?
P wave.
P wave, correct. What this wave?
T wave.
T wave, very good. Oh, what this wave?
Is that the QRS?
Q.
one?
Wait, was it
Don't
a Q wave?
don't get panic, my wonderful student. This is not a wave from the heart. Okay, so I don't need you to get confused. This is not a wave coming from the heart. What this? This is the spike which comes from the pacemaker. We are going to talk about this in details, but this is the QRS, man. This is the QRS. This is the QRS. This is the QRS. This is the QRS. We will have this strip in details with the pacemaker next chapter. But I think the author put it in wrong way. Not belong to the heart block, okay? But we have to find that this is very interesting. We are going to learn something new. So this spike of pacemaker, artificial pacemaker, we are going to talk about this next time, that we are going to place electrodes either inside the atrium or inside the ventricle, and this situation is the spike or the wire is inserted into the right ventricle, so it will produce contraction of the ventricle, which has a character to be wide, as you see, wide. So this is wide QRS after stimulation by the spike. So this strip is like getting you guys, and it is not belong to actually the third degree, but we are going to talk about this in next chapter, God willing. So don't get panic about this is not the QRS. This is the QRS. All right. Any questions so far? So we're done with chapter 11, and we are going to start, God willing, on Monday, chapter 12 and chapter 13. But I need to add two important subjects, which the stress test and also the Holter monitor. Okay, so today we are going to meet at 1 p.m. to finish the pacemaker, to make like your knowledge updated about, like we touched this strip. So we are going to analyze what is the pacemaker and you get familiar about this. All right. So for now, we're done with our lecture and I'm going to stop recording.